Got this one there. Testing 1 2. 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 Testing 1 2.
Fire second. Mr. Adams is coming. He wants to ask questions to the fire chief.
Good afternoon, everyone. Good afternoon. My name is Wanika Fisher, and I have the honor of chairing Public Safety, Health, and Human Services for the Prince George's County Council. Today, we continue with our budget hearing sessions for fiscal year 2027, and today we'll be going over I'm changing the order a little bit, the budgets for the Administrative Charging Committee, our Fire, Emergency, and Medical Services Department, and then our Department of Social Services. First, we will start with our Administrative Charging Committee, but before I continue, I forgot. I got a call to order to the committee. So, Madam Clerk, if you can call the roll.
Councilmember Fisher,
Present.
Councilmember Hunter,
Present.
Councilmember Oyata, Councilmember Burrows, 4 present.
We have 4 present. We are acting in full committee. And now we'll turn to Mr. Nathaniel Tutt, who is our amazing committee director, to introduce our first agency, the Administrative Charging Committee. And you can come to the table, those that will be presenting.
Thank you, Madam Chair. First, as you said, the Administrative Charging Committee, and that's led by Director Ms. Isabel Williams, who's joined us at the table. And on page 12, you'll find the report from the agency. And next will be Mr. Malcolm Moody, who will provide an overview.
Good afternoon, Chair Fisher and the rest of the council. My name is Malcolm Moody, Budget and Policy Analyst. And then I'm going to start with the Administrative Charging Committee's presentation. And then on the, okay, there we go. And then on this slide, I'm just going to highlight the organizational structure, which is on the left. And then the top right, which shows the main mission for the ACC. And then the bottom right, which also shows the core services. And this information is in the budget book. This next slide is on the strategic focus for the ACC. And then some of the strategic focuses for fiscal year 2027 for the ACC are improving turnaround times, refining, streamlining the review process, and strengthening collaboration with key stakeholders. This slide is focusing on the fiscal year 2027 budget for the ACC, and at the top is a multi-year chart of the expenditures by fund type, and then below is the fiscal year 2027 proposed budget, which is broken down, and you see it's proposed at 1.4 million, and then the proposed budget is it's decreased from the fiscal year 2026 budget by 7%. The next slide is covering the general funds for this for the proposed fiscal year 2027. And then the amount proposed is 1.3 million, and then this is an increase of 3.4% or 42,300 from the fiscal year 2026 budget. And the general fund compensation is proposed at $745,500, and this is an increase of $41,500 from the fiscal year 2026 budget. And this helps fund 8 full-time positions. And you'll also see on this chart, this slide, that the operating has decreased, and the net decrease is due to revised projections for trial staff and case hearings. And then the operating expenses, also the operating expenses help support trial prep, trial board judges, stipends, and community awareness events. And then the fringe benefits have also increased. This next slide is highlighting the staffing and grant funding for the ACC. And you'll see the grant funding compensation is proposed at $150,000, which is a 50% decrease from the fiscal year 2026 budget. And this is due to a reduction in the violence intervention and prevention program. And the operating grant expenses are used to support program operational expenses. And I already noted the full-time 8 full-time positions in the previous slide. And then this slide is going over state legislation. None of the state legislation made it to the governor's desk, but it was potentially going to affect the ACC if it did. I just wanted to include it in this slide. And then on this last slide, it's just highlighting these are essentially the biggest concerns for the ACC. The top one I wanted to note was the vacancies, which are awaiting necessary approvals. And then the also funding. Funding is not fully accommodating the growing costs for the administrative law judges. And you also see additional concerns such as grant funding expiring, caseload volume, which is increasing every year. And then there's a strain on resources during the administrative hearing board process as funding levels tighten. And then finally, there's also reviewed cases that have resulted in reduced penalties. That ends my presentation. Thank you.
Thank you, Mr. Moody. Now we'll turn to Ms. Williams, our program manager for the Administrative Card Charging Committee.
Thank you, Chair Fisher. Mr. Moody did a great job summarizing our agency, so I do not really have anything to add unless there are any questions.
Colleagues, do you have any questions? The only thing that I would ask Ms. Williams, what do you think that you might need in this budget that is not here that the council sees?
I think the council does a great job of trying to assist us in meeting a lot of our needs. Right now, we're just trying to be creative in finding ways to accommodate things. The council included funding for our case management system in the prior budget. So right now we're just trying to get that up and running. And so one thing I will note is that there was federal funding in the prior budget that's sunsetting that we're hoping to use for IT interns to help get our case management system up and running. So my hope is that we can maybe find collaborative ways to plug that funding gap when that federal funding sunsets.
When is that going to sunset, Ms. Williams, you know?
2027.
In 2027.
Mhm.
Oh, go ahead, Madam Chair.
Based on what you said, so you need like intern level help to assist with getting it online, or just so we can understand like how we could best be of assistance?
We try to use interns to save the county money instead of asking for full-time positions like graduate level interns. So we will use whatever we can get, but right now we're requesting intern level assistance to mitigate costs to the county.
And is it for temporary, meaning like just getting it up and running, or you need that like an FTE for like continuous support?
In my ideal world, we would love a full-time employee to run stats continuously, to dig down into where specific trends are happening with relation to identify where specific police misconduct instances are happening. Are there racial trends in this district? Are there trends related to, specific things in this district? Are there speed traps in district? We want to be able to dig down in that, but without the necessary personnel, it's really hard for us. We know it's a really difficult season for everyone, so we are not making requests. We're just saying, ideally, we would love to have that.
Thank you.
And then I was going to also just ask you a little bit of a question about the 2 investigators you have. You don't have any vacancies, right, for any of the 8 positions, right? Or
One of our investigators went to PGPD, so we do have a
you
vacancy.
do? Okay. And you're advertising and looking for a second investigator,
Yeah,
right?
we're in the process of
Okay, that's good. And I just need one more second. What's the status of our citizen complement for the committee?
We have 1 appointment that is expired,
Uh-huh.
and then we have 4 that will expire in June 30th of 2026.
Can you make sure you send us an advertisement for it so the council members can put that out to the community
Absolutely.
and have, the actual compensation that they do get to serve, I think would be helpful. So I think residents would be interested in serving that capacity, but I don't think that they know that they get compensation and what's coming up. I would appreciate that. Madam Chair.
That reminded me, if someone serves, can they continue to serve, or is there like a limit?
The legislation limits them to 2 consecutive terms.
2 consecutive terms, and everyone's on their first?
Mhm.
Okay, thank you.
I think that concludes. Oh, and I want to say we've been joined by Councilmember Adams, Councilmember Burrows. Councilmember Adams, do you have any questions for the ACC? You're good? Okay. Oh, you are dismissed. Thank you for attending to your FY 2027 budget hearing. Appreciate you. And next, I changed our order a little bit. We're going to be going to our fire and emergency services. Mr. Tutt, if you can introduce the fire department's budget. Thank you.
Yes, ma'am. Next, we'll have the fire emergency medical services for the county, and we're being joined at the table now by Fire Chief Michaelides, Chief Deputy BJ Harris, Deputy Chief Carol Spriggs, Deputy Fire Chief Ronnie Gill, Acting Deputy Fire Chief Dave Wilson, Assistant Fire Chief Michael White, and Fiscal Affairs Specialist Kimberly Weissman. And you will find the volunteer report on page 50 and the career services report on page 63 in your virtual binders. Thank you, Madam Chair.
Okay.
And I should note that Mr. David Williams prepared the report, and when you're ready, he's available to give an overview.
Yes. So good to see you, Madam Chief. And I switched the order because I had y'all waiting like an hour last time. So I'm trying to be fair, give everyone good time. Who's doing the report again, Mr. Tutt? Sorry.
Mr. Williams.
Mr. Williams, you can go ahead and start. Fire department.
Good afternoon, Madam Chair, Madam Council Chair, members of the committee. My name is David Williams with the Budget and Policy Analysis Division. I'll be providing a brief overview of the fiscal year 2027 proposed budget for fire and EMS. Here you can view the department's mission statement, organizational structure, and some of the core services. Here you can view the department's areas of strategic focus headed into the next fiscal year. The fiscal year 2027 proposed budget stands at $325.9 million, marking an increase of 12.1%. 96.8% of these funds are sourced from the general fund. The remaining 3.2 can be sourced from grant funds. The department anticipates a supplemental budget request of approximately $1.5 million. The general fund allocation is proposed at $163.5 million in compensation. 40.5 million for operating expenditures and 121.9 million in fringe benefits. The department also anticipates $175,000 in recoveries. The department's grant budget allocation is 10.7 million, marking a 7.6% increase from the previous fiscal year. Here you can view some of the largest grant funding sources. The department anticipates an increase of 22 positions for the full-time civilian component, 46 positions for the full-time sworn staffing component. The full-time and civilian limited grant term funding staffing components remain unchanged, and there are currently 149 general fund vacancies. The department notes a serious need to acquire PPE equipment for both active and training personnel and fleet maintenance and replacement costs. Here are some key areas of concern, including but not limited to demand for PPE equipment, volunteer recruiting concerns, and capital improvements for dilapidated facilities. That concludes my budget overview for the fire department. Thank you.
Thank you, Mr. Williams. Good afternoon, Chief Michaelides. Welcome to the committee. We will turn to you for your presentation for your FY 2027 budget.
Is this on? Okay. Good afternoon, Chair Fisher, Vice Chair, members of the Public Safety, Health, and Human Service Committee, Local 1619 President Grant Walker, and Donnie Well, the President of the Volunteer Fire Rescue Association. Thank you on behalf of the Prince George's County Fire EMS Department for the committee's continued partnership and oversight. We appreciate the council's continued focus on ensuring public safety readiness through investments that allow us to keep pace with operational demands and continue to serve our residents, businesses, and visitors. As part of our budget discussion, we want to extend our gratitude to the committee for authorizing increased staffing complements over the last 2 fiscal years. The impact that change has had on our ability to staff units, control workload, and ensure reliable resources throughout the county cannot be understated. We understand that those investments came at the expense of difficult budget decisions elsewhere, and we are grateful that the community values having fire EMS personnel available to deliver service safely and effectively to the county. Looking forward to next year's budget, we will be prepared to discuss what it will take to support those positive trends as we continue to add to our departmental complement of resources. A significant part of that discussion will include hiring additional civilian employees to fill vacancies left by sworn members currently filling civilian coded positions. This allows us to return sworn personnel to positions where they can best use their training in either field or supervisory roles, while maintaining civilian functions with qualified staff. We view this strategy as a fiscally responsible ways to increase staffing and readiness without sacrificing administrative capabilities. We also want to continue our partnership with the committee on the first station construction agenda and associated operational consideration. As a department, we are supportive of the county's effort to construct new stations and modernize older facilities. You can expect our FY 2027 budget request to reflect the infrastructure and personnel needs required to open stations as intended. Recruitment and retention of volunteers remain a top priority, and we are looking for ways to expand opportunities to serve. Through the Fire EMS volunteer recruiters, we are working with our volunteer membership committees to better coordinate our recruitment efforts. We hope to improve the applicant pipeline in our volunteer programs, increase our conversion rate of applicants to active volunteers, and identify new ways to allow community members to become involved and served. In FY 2027, we will continue to make investments that allow us to grow volunteer capacity while supporting high standards of training and accountability. Lastly, we are updating the Fire EMS strategic plan. The plan will provide an up-to-date assessment of current performance levels throughout the department. The update will allow us to better articulate our operational posture, highlights areas where we are seeing improvement, and identify where additional resource may be needed. We hope to provide the committee with a transparent view into our service delivery and resource needs by tying budget decision to measurable public safety outcomes. So I have a few of my top accomplishments. We immediately put in place a command structure to ensure we could effectively and efficiently manage the many commands and office that make up the Fire EMS department. The key in this was the role of the chief deputy, along with filling vacancies and reorganizing the existing commands and deputy fire chiefs. To increase uniform staffing, we shift 35% sworn personnel from civilian roles back to the fire station to minimize mandatory overtime and holdovers, with plans to increase civilian positions from 83 to 105 to prevent this from occurring again. 3, we reconstructed the Training and Leadership Academy with a renewed focus on the professional development of personnel, both volunteer and career, in emergency medical service and fire by combining our operational performance and research office and our EMS development office with our training and leadership academy. 4, we returned sworn day work personnel to the Berwyn Heights Fire Station 814 who were removed in the summer staffing plan of 2024. Reinstating personnel supports the local volunteer company, helping the community with faster response time and guaranteed daytime staffing. 5, to continue strengthening our ties with our valued community, we launched a Coffee Circle chat. This provides a safe place for our residents and visitors to share their thoughts and opinions directly with the Fire EMS Department command staff. We held these events at local businesses during high peaks period to touch as many people as possible. 6, due to a rise in accidents, the Fire EMS Department initiated the Drive Risk Intervention Vehicle Enforcement Program. This program helps Fire EMS members stay aware of apparatus safety and reduce accidents by enforcing department policies and procedures to protect residents and visitors while emergency apparatus respond to emergencies. Since the implementation, we have seen a significant reduction in both preventable and non-preventable accidents, increased awareness among our emergency vehicle operators, and enable the Fire EMS Department to reduce the risk of serious injury and loss of life to our members and residents. 7, we're hosting a 2-day girls camp, Camp Trailblazer, this summer on June 27th and the 28th. Our mission is to empower, inspire, and support young girls ages 15 to 18 who will participate in hands-on Fire EMS training activities that are fun, safe, interactive, and physically challenging. They will gain strength and knowledge, build confidence, develop leadership skills, and broaden their problem-solving abilities as they explore careers in their rewarding field. 8, we launched the Lexapro Cortico Wellness app designed to support our firefighters and EMS professionals in managing their mental health. It offers a wide range of resources from self-assessment to therapist directories. 9, the Fire EMS Department has committed a building trust with all of our responders, volunteer and career, our civilian employees, and our external stakeholders by holding bi-weekly meetings with our deputy fire chiefs, monthly meetings with the command staff, attend monthly meetings with volunteer stakeholders at their monthly meetings, quarterly meetings with volunteer leadership, visiting fire stations to connect with our dedicated responders, participating in community-focused events alongside other public safety partners and community leaders to share resource and knowledge. 10, since July 2025, we have promoted 10 technicians, 19 lieutenants, 5 captains, 2 battalion chiefs, 1 assistant fire chief, 2 deputy fire chiefs, and have hired 130 recruits in the last 12 months. In my last 10 months. 11, our training and leadership academy is currently running a career recruit number 73 with 13 recruits remaining, career 74 with 58 recruits scheduled to graduate in October 2026. Career recruit number 75 is scheduled for June 2026 with graduation in June 2027. We also have 2 upcoming graduations. Career Recruit School number 73 will graduate on June 18th with 21 recruits. And we also have our high school fire science cadet number 13 is graduating with 15 high school seniors on May 12th. And our goal is to maintain a safety and healthy workplace environment and ensure alignment with the county exec's initiatives. Thank you.
Thank you so much, Madam Chief and Deputy Chiefs that are here. Did you, before I go to questions from the colleagues, do you want to introduce your team, Madam Chief, and then I'll take questions.
Yes, ma'am. Thank you. To my right is Carol Spriggs. He's our Deputy Fire Chief of Homeland Security and Member Services. To my left is BJ Harris, my Chief Deputy. We have Deputy Fire Chief Ronnie Gill, who runs Special Service Command. Acting Deputy Fire Chief Dave Wilson, he runs Emergency Service Command. We have Kimberly Wiseman, the budget analyst. And we have Assistant Fire Chief Mike White, who's he has the Volunteer Service Command.
Great. I know them, but just for the public and for everyone else. Colleagues, questions? Madam Chair, I'll start with you.
Sure. Thank you, and always good to see you. A few questions. One of the things I've been, and this is for a few years, kind of playing around with trying to understand if this would help, is I know right now, for example, if someone comes on to work for the fire department, they have to do both, like qualified to ride the trucks and do like emergency response. Is that still the case right now?
Yes, ma'am, that's still the case.
And certain jurisdictions have it separately where you don't have to necessarily be qualified to be a firefighter, but you could ride and do like ambulance, EMT. And I've always tried to understand, like, would that benefit us when it comes to like staffing, like the issues around overtime, and just wanted to hear from your perspective, is that something we should be looking at?
Okay, so I want to go back into 1987 when I started. We did have an opportunity to, you can only be a firefighter or you can be a paramedic. So it didn't matter which track that you used. I mean that you wanted to be in. But in 1995, the fire department came up with this pilot program to introduce the cross train, which is firefighter paramedic, just to have the cross train capability. You want to add anything to that?
I would say, so in the short term, in the last 9 months, we've opened up 3 different application processes, and we've taken in almost 3,000 applications. So it's not necessarily a recruitment problem. There is that class specification of work that exists, but there's complications that come into that. There's hourly requirements that we need to the system, how that would fit back in. It used to be present. We're not against still investigating that, but our focus since we started was kind of to stabilize, as you probably remember, the mandatory overtime problem with our current deployment was to stabilize that first, which, with the 130 people, it'll be 170 by June. And for the first time, I think in a long time, we are hopeful we'll be at our authorized staffing by the end of the fiscal year.
And to change that, is that something that happens during negotiation, or is that just a policy change to allow for people to, even if we had it where you could be both, right? Someone that qualifies for both or had one or the other.
It exists today. It would just be, it's a class specification that we're not using. We would just have to advertise for it and put it, but operationalizing it would be complicated. Different hours of work, the coverage, supervision, that type of promotional opportunities.
And maybe that's something we can talk more offline about. I'm just
Yes, ma'am.
interested in it. Talking to some of the members, it's come up as an option.
Yes, ma'am.
Now, I don't know what works best.
Yeah.
So I want to hear thoughts from you all and thoughts from the women and men that serve in this capacity to see if it makes sense of something that we should look into.
Yes, ma'am.
Wanted to understand with the current vacancies. So are we fully staffed in both the civilian and sworn at the budgeted 85, for example, for FY26 and 1,147 for sworn in 26? Are we already fully staffed there? Or those are just the that's just the composition you have, and we're still asking for more composition in FY27?
Chief Spritz.
So we do currently have some civilian vacancies, which we are working to fill prior to the end of the fiscal year. We're hopeful that we will be able to do that. With regard to our sworn vacancies, as Chief Deputy Harris mentioned, we have another recruit class that's starting in June. And so that should allow us to completely fill our sworn vacancies prior to the end of the fiscal year.
So you'll hit that 1,147 number.
We are hopeful to, yes, ma'am.
Oh, perfect. And this increase of 46, you feel like that's all you all need?
Well, this county continues to grow.
Mm-hmm.
We are very busy and we're going to get busier.
Mm-hmm.
As long as, we keep developing here, I mean, we're going to always need, more sworn personnel, or there's sworn or volunteers, and we're also going to need fire stations, but we need people to put them in them.
Madam Chair, you took my question.
Oh, I'm sorry.
Okay.
2 more and I'm done.
Fine, Madam Chair.
Okay. I was looking at the change in compensation for 2 categories in particular, the Emergency Services Command and Support Services Command. And I saw the reduction in the emergency service and an increase in support services. But I want to understand the difference, because when I read it, it seemed, and so I could just be not understanding the way it's labeled here, that the Emergency Service Command would do more of the calls, right, for service, and that the Support Service Command would do more of like the logistics or maintenance or things that don't actually go out for calls. So I was just curious about seeing a decrease in emergency service and an increase in compensation for support services.
So there was some restructuring that occurred, the fire chief made, and so some personnel that were assigned to the Emergency Services Command were reassigned to the Support Services Command. And so as such, the compensation went along with him. That would explain the decrease from one to the other.
But does that change any of our ability to do emergency calls? Because it says if they went from emergency to support services.
No, ma'am.
And then I think that's all my questions.
Okay, thank you, Madam Chair. I see I've been joined by, I can't see all the way down there. Hi, other colleagues, Councilmember Janoga, Councilwoman, Vice Chair of this committee, Councilmember Bouguet. Any questions from down there for my questions? You all don't have any questions. Mr. Burrows, do you have anything? Okay, no, you can go ahead. I go last usually, but it's up to you.
Okay. Good afternoon. And I just want to thank you, Fire Chief, for all the work that you're doing, and all the collaboration that we have means a lot to our team, from our youth and young adults who are going to be interns with you to the fire initiative named after the young man who passed away on Oth Road. We thoroughly enjoy collaborating with you and your entire team. A question that I had, what is the feasibility of doing, speeding up the hiring process? My understanding is that it takes about 9 months now. Are there things that we can do differently in OHRM or anywhere, basically, to speed up the hiring? Because I'm afraid that, I know at least for the high school cadet program that you mentioned in the past, there would not be hiring windows available for them, and they would end up getting recruited to other jurisdictions pretty quickly. So what, in an ideal world, what would you need from county government to cut hiring, that timeline?
Well, I'll let Chief Harris answer that question, but we are working on that. So if you want to go a little bit more.
We coming into the system, right? All new agency heads, new directors, new processes. The team has been really good. Our internal team, the HR team, Deputy Chief Spriggs, our budget team, the internal fire HR team, OHRM Director Bridgeforth, OMB Ms. Fair. Ms. Fair, shout out to Ms. Fair. Thank you. Lurking in the corner. Some of those challenges that we faced, and to illustrate kind of what you have, we have a recruit in session now that applied 2 years ago from the old way. We have a recruit in session now that applied 8 months ago. So we are making drastic improvements, and continue, right? Like it's just an ongoing improving those processes. We can always be better. There's always room to improve, but we are hopeful to continue on that front.
No, I'm happy to hear about the progress that has been made, and I'm sure that's going to make a big difference. What, in an ideal world, if you had the county executive, the county council on the same page, I mean, what would speed up the process even more?
I think
That's really a OHRM question, but we enhanced our HR position, positions. So we just received, two HR specialists. Yeah, so they've been very helpful moving this process along. So, and that's why we're able to do what we're doing now. Before we didn't have that, but now we have, people that are being hired.
Thank you. Sorry. So just to add to some of the points that they made, Councilman, there are certain things that we require throughout our process. One of those things being our candidate physical ability test. And that's something that every person that works for the department has to successfully complete prior to hiring. But as a part of that, we offer what's called a mentoring session. And so we allow applicants to actually come in for several weeks to practice so they can pass this test. And so for us to eliminate that, we would actually lower the standards for the people that we onboard. And we would also decrease the chances of people being able to successfully complete that physical ability test. And so that can be anywhere from 8 to 10 weeks, just the mentoring process alone. Obviously, we'll get some candidates that will apply that have taken that ability test in other jurisdictions, and we do honor that. That test is valid for up to 1 year, and that's across the state and even across the jurisdictions into Virginia and the District of Columbia. So there are some things that we could probably do background-wise to try and reduce that time frame, but still, we want to make sure we're hiring quality individuals that are going to serve the residents and the visitors of Prince George's County.
And are we seeing cadets, what they call cadets, other recruits, or I don't know, are we seeing the applicants who are in the middle of the process being recruited by other jurisdictions in the middle of the Prince George's process?
I can tell you, when I started working for the fire service, you applied to multiple jurisdictions because you wanted a job. And so we are all competing for the same individuals. And so we have to make it attractive for them to want to come work for Prince George's County. And if we can reduce the time, like like you mentioned, to make that more attractive, then that's one of the things that, like Chief Harris said, we have accomplished a significant reduction in that recruiting or in that time frame to get hired. But there are other things that we can do also to incentivize folks to want to work for Prince George's County. But yes, sir, they are actively looking at other places.
And when you say there are other things that we can do to incentivize or maybe speed up the time, what are those things? Because I guess I'm trying to figure out practically what we can do to help you cut the time significantly, to make it more attractive, so that when other jurisdictions are trying to poach our folks, maybe we should be poaching their folks. I don't know.
Wait, you want me to answer that one? Okay, so I think it's more geared to salary and the shifts that we work. I mean, we have a good shift, 24/72, and there's other neighboring jurisdiction, they work 24/48. But for me, the 24/72 works best for me. And the salary is another issue as well, right? And then sometimes, the salary could persuade you to go to another jurisdiction, no matter what the shift is.
That makes perfect sense.
Yeah, we have to look at that. Thank you so much, Councilmember Burrows. I'm gonna go back to Councilwoman Oriata after I just do one of my questions. Madam Chair Oriata. Madam Chair talked a little bit about do we have enough firefighter positions? You already answered that, but I will say, colleagues, and I know Ms. Fair, and I think Andrew's always in here. I really would like to look at increasing that that number for FY26. I just don't think that that's going to be enough. So I'm just saying it. I mean, FY27. Thank you. Sorry. So I'm just saying that out loud. So as we meet, we can work on that. That's something that I'm very interested in. And then in your proposed budget, I know one of your focuses is to build leadership and depth and succession pipelines in the department. And I wanted to know a little bit about what are you doing to retain our fire and EMS officers at every level of the department?
Oh, one of the things that we're doing is improving the work condition, their education, training. We providing them with the best equipment, and we always want all of our personnel to feel welcome and supported.
Okay, thank you. And then maybe Madam Chief, if at a later time or as follow-up, we can have like a little bit more detail to help to see how the council can support on your recruitment and training, so you have that pipeline and that it's effective for your members. I think that would be a good follow-up. I'm looking at Mr. Gill, just speaking, not that you assigned it to him, but I'm looking at him for it. So maybe you can assign it that way. I don't know, because I know it's true. And how do you feel like are we retaining our officers? You know, I think Councilmember Burrows brought up with catching them in, but I think one of the things that I don't think the public sees or that we really understand is like we lose people once they're in. So how do you, or what does the department do to measure our retention? Maybe Deputy Chief Harris?
So, you know, the hiring, trying to stay on a positive note, the hiring's been great. We're on a good path moving forward, but it wasn't that long ago that like August 2025, it was 3,000 hours of mandatories, you know, and so when you think about, you know, that wasn't that long ago, and that certainly has an influence on you deciding if you want to stay or go. The other piece is, you know, we have, just like a lot of public safety, is a retirement, that 20-year retirement. We have 71 people eligible in the next 12 months, but the next 3 years, that slows up, and that represented a decrease in hiring again 20 years ago. We believe that's our opportunity to regain that lost ground. After those 3 years, it will be challenging because of the repetitive hiring that occurred back then, and just the normal attrition. This is hard work. I mean, right? It's the room's filled with responders. It's hard work. 173,000 calls a year, almost 500 calls a day. We're pressing almost taking 75,000 emergency transports a year, taking people to the hospital. Like it's taxing hard work. So we certainly appreciate the support of increasing.
Yes, and I think we know, this committee knows how hard you all work, and for the responders and the firefighters, I have relationships with, and I see you all in the audience say, we know how hard you all work, and it's a lot of calls. I mean, when I went to the fire training, I did good. I did well with my EMS a little bit, but carrying someone downstairs who's over 200 pounds is very taxing, and I wouldn't survive the test. I don't think so, Deputy Spriggs. Madam Chair, and then colleagues, if you have any other questions before we conclude. Go ahead, Madam Vice Chair.
No, thank you. I wanted to circle back to an issue that myself and Councilmember Burrows worked a lot on last year. There was a discrepancy on the use of cannabis and the issue with like people getting through the interview process. I just want to make sure that that's been fixed. We're in a good place now, or is that still an issue that we need to revisit?
I wasn't aware of that issue, but
Okay.
I can speak pretty comfortably that it's been resolved.
Okay, because we had people still being denied in the interview process, even though they shouldn't have been under past leadership. So I'm glad to see that's something that has been addressed. And then going back to what you said about the physical training aspect. Now, into my original question about if someone's qualified for EMS or paramedic versus fire. So is that one of the standard differences that, because when I did talk to some people, they said that was a concern that they could qualify as a paramedic, but they wouldn't qualify as a firefighter?
Yes, ma'am, that would be a difference. Someone that potentially would work as an EMS provider only may not necessarily need to go through the candidate physical ability test to be a firefighter.
Thank you.
Madam Chief, you look like you wanted to say something to Madam Chair about that. Your face, no, you're good.
I'm good.
Okay, you were like, oh no, and you were like, okay. Before we conclude, Deputy Chief Harris, I did want to ask you a little bit about what are the details in our deferred retirement option plan. I know that our police does 7. I think you all are 2 to 3. About how are you all looking into using that as a tool to retain who we have, and maybe you can address that, and maybe what do we need to do to help you with that tool?
We certainly, the benefit of the deferred retirement allows us the ability to plan, for the future and adjust hiring. Right now, I mean, the hiring is just basically out of drastic need. But at some point, if we reach authorized staffing and we're back in the communities where we need to be in and provide service and meet the demand, certainly it allows for planning. The current, it's a 3-year initial drop with a 2-year extension currently. We were happy with the county executives' help to be able to offer that to fire officials this year. Everyone's put a lot of work into it. The chief, Mr. Powell.
Well, and I'm appreciative of that. I would say I think you should look into seeing what we can do to have parity with the police department
Yes,
on the
ma'am.
same amount.
Yes, ma'am.
I think would be helpful.
Yes, ma'am.
Okay, well with that, everyone's quiet today. You have concluded your FY 2027 budget hearing. Thank you, Madam Chief. Thank you to your entire complement of the fire department. Deputy Chief Gill, you have something you want to? Oh, is there a question? Oh, I'm sorry. I've been at Councilmember Adams.
I first want to say thank you for being here today, and thank you for all the work you do. One of the interests I have is how you support the volunteer fire department. You know, I have special interests in Station 35 and Station, I think it's 39. And what are we going to do to get back to where we can reduce those times, that we can get all the things we need to get back fully staffed there? What's your plan at this point?
Mike, do you want to just speak a little bit about volunteer recruitment overall, and then I'll.
I thought I don't think they have done the volunteer portion yet.
Okay.
So a lot of that's covered there, but I mean, as far as volunteer recruitment, with our volunteer recruiters mentioned in the fire EMS budget, we just continue our efforts with working with the stations. We got an applicant tracking system that helps with the stations with tracking the system and how volunteers are come through the system, how they get onboarded with each individual station. So we really leave it on the stations for a lot of their volunteer recruitment efforts, but we give them all the support we can in helping them get to that point.
Okay, so they're going to be coming up on the Volunteer Fire Commission?
I know some of it's in there. I didn't want to get ahead of what's in there.
Okay.
Yeah.
Thank you.
Yes, sir.
And I apologize. That was my mistake when I called up. I will be doing the Volunteer Fire Commission after you all. So if you could just hang around for that in case, I would appreciate it. But I messed up the calling of that. Councilmember Adams, so my apologies. So they'll be coming up. Okay, well with that, we have concluded your FY 2027 budget hearing. I thank you. I look forward to the follow-ups. Thank you, Madam Chief, for your leadership. And this was very fruitful. So if you could just stay in the audience in case the colleagues might have a question that intersect with our
Yes,
volunteer fire commission. We appreciate that. Thank you.
Hey, thank you all.
Thank you.
And at this time, I will call up, we will do our volunteer fire commission FY 2027 budget overview. Mr. Tutt, if you could have Mr. Williams go over the presentation.
Thank you, Madam Chair. We're pulling up the presentation now.
Okay.
Here we are, Mr. Williams, when you're ready.
Good afternoon, Madam Chair.
Okay. Oh, you do both. I don't know why. Sorry, I'm off today. Madam Chief does both. I don't know why I thought it was separate. I don't know. I got confused with my notes. I'm sorry. Thank you, Madam Chief, for coming back to the table. I'm sorry. You're not dismissed yet. We're going to go over our volunteer fire commission. I'm sorry. Go ahead, Mr. Williams.
Good afternoon, Madam Chair, Madam Council Chair, David Williams again, and I will be providing a brief overview of the fiscal year 2027 proposed budget for the Volunteer Fire Commission. Housed within the operational umbrella of the fire department, the mission and core services are identical. Here are some of the areas of strategic focus headed into the next fiscal year for the Volunteer Fire Commission. General fund allocation for the commission stands proposed at $20.5 million, marking an increase of 1.5% from the previous fiscal year. The breakdown is as follows: $628,300 for compensation, $14.3 million in operating expenditures, and $5.6 million for fringe benefits. The grant funding allocation for the commission is $2.06 million, marking an increase of 19.1% from the previous fiscal year. The commission's full-time staffing component is anticipated to increase by 1 position, with the full-time sworn complement remaining unchanged. There are currently 1,168 volunteer personnel. The Length of Service Award Program, or LOSAP, database has experienced setbacks due to some staffing shortages, but however, the commission has hired an administrator. Some additional areas of concern including but not limited to the declining volunteer staffing pool, dilapidated facilities, and replacing aging equipment. That concludes my budget overview. Thank you very much.
Thank you, Mr. Williams. And now I will turn to Assistant Fire Chief White for your remarks regarding the Volunteer Fire Commission.
Thank you, Madam Chair. A couple of things, as mentioned, I really don't have a prepared speech for the Volunteer Fire Commission. Obviously, not speaking necessarily for the commission, but we work on their budget and Volunteer Services Office. A lot of effort and a lot of things have pointed to the direction of volunteer recruitment, taking care of the volunteer stations that we have currently, where we house and operate out of. And we, as volunteer and career, both operate on multiple stations that the volunteer corporations own, which tends to be a hiccup as we get through things. Improving the LOSAP program, or how we have it now. We hired a LOSAP administrator in the Fire Commission office last year, whose main focus was just to manage the LOSAP budget, which is roughly about $5.1 million annually. So that program, doing well, obviously has some issues because there is a lot of human interface there when we deal with the pension office and things that require manual entry. So as mentioned in the budget document, there was an attempt to do a LOSAP system a few years ago, application with OIT. That seemed to kind of fall down just because of the amount of hours it took to get the app up. The information that was coming in was a little difficult to capture between each individual station. So that app had not been fully executed. And that put us back to, kind of building up with the administrator at Ground Zero.
Thank you for that. Colleagues, you have, I see, Mr. Adams, you have your mic. You want to address anything?
I was going to go back to my previous questions, but I'll wait on you, Madam Chair.
I'm calling on you. You all go first. I go
Thank you.
last.
Hey, it goes back to we didn't want to get ahead of ourselves. So going back to it, with engine 35, engine 39, and the wait times now because we're understaffed, and we understood that, you know. But I'd like to know what our plan is to get back to where we fully staff them. What do we need to do? What is your plan to help the volunteers get to where they need to be?
Just to, in addition to, so the staffing, I think you're referring to for 35 and 39 is the career staffing that was
Yes.
removed. Yeah. So, right in the previous session, we talked about the hiring and those people, but it just takes getting them in the door is one piece, but it can be 4 months based on the certifications that they walk in the door when we onboard them to almost 8 months till they're ready to go. And so, that the ability to deploy those people wherever they're needed, whichever stations they're needed at, we're still, I know it seems like 9 months seems like a long time, but we just haven't had that time to get them trained and available for deployment, specifically to those stations. Go ahead, sir. Yes, sir.
No, I was going to say, well, how will you help them to recruit volunteers to staff it completely?
I think the continued efforts of the volunteer recruiter, like we've pretty done a lot of the effort for the volunteer stations. They have to do the recruitment. We're there to assist them with recruitment, but those volunteer stations, there has to be somebody there in order for the recruits that we send there to train them. So the typical volunteer has up to 36 months to get Firefighter 1 and EMT, the two basic classes that you need. So over that 36-month period, which we increased with the legislation change last year or the year before last in 2024, with the change in the volunteer training standards, that increase allowed more opportunity for volunteers to get recruited and to go through the process. But it takes 3 years at minimum allowance for those members to get that training.
And I would just add, the cadet program is wildly popular. There's a waiting list for those to attend. There's also ideas of trying to, for those that may, and it's not available everywhere throughout the county. So, in just recruitment in general, there's thoughts or ideas of, hey, how can we bring those interested teens or young people to be involved?
I see Councilmember Hunter has a question, and anyone else for the queue, and Mr. Janoga. So I'll go with Ms. Hunter first, and then Mr. Janoga.
Good afternoon. How many volunteer stations are there?
Currently, we have 36 volunteer corporations in the county.
36. And can you go into a little detail in regards to the needs of those or specific conditions of those volunteer stations? What are the primary needs?
So it would mostly fall under support services. In addition to people, we need people. The buildings are older, and not to kind of rehash, but the history of how the government operates, we tend to defer a lot of time our CIP budgets when times are hard. And I think the effect of that is we have an aging, you guys already all know this, so, but we defer that, and we're in it now, for lack of a better term. Like, the working conditions could be better, the buildings could be better, but it's a cost. Everything, the rising costs of construction are in a 7-month time frame. It's crazy how fast the costs are increasing. Equipment, the coat and pants that they wear now, firefighters wear, it's $4,000 per on per just that one set times, the people. A fire engine, $1.2 million. A ladder truck, $2.1 million, with wait times that are approaching, could be 4 years in some cases. An ambulance, $450,000. Those are all costs, certainly from the county that we bear, but also the volunteer corporations that you see, the trucks branded by their individual corporations. That's a portable radio they communicate on, $14,000 per each individual radio. Those are, I could keep going on costs if you want. That's just some examples.
So have these costs been included in your budget FY27, or are we looking at trying to prioritize which volunteer station should be addressed first, or how does that work?
You'll notice some priority. We were happy. So the Hydesville Volunteer Firehouse on Bellcrest Road, that project is, for anybody familiar with the CIP, it's been in the CIP for 12 years. Yeah. And we were able to get some movement. Yeah. We are very excited to have some movement on it. And some in May, next month, finally after this time, to improve those conditions in that area. And our hope is continue that process, get us back on a path to not only with new construction, but the renovations as well.
Thank you. And again, the work that you all do is just remarkable. Absolutely remarkable. Thank you for your service.
I will say that we've spent hours amongst hours looking at our CIP projects, making sure we're prioritizing our facilities that we need to renovate, rebuild, or repair. So it's as the chief deputy said, this is something that's been kicked down the road for a number of years, and at least this administration and this team is working to see if we can get these projects off the ground.
Thank you so much, Deputy Chief Gill. And now I'll turn to, I'm sorry, Madam Chief. Madam Chief, if you can press the little button for me. Thank you.
One more other thing that the chief deputy forgot to mention is that when we are, wanting new apparatus, it could take 45 years before we even get apparatus.
That's a long way. We gotta look at that. Councilmember Janoga? And if I don't see someone else, please raise your hand for me.
Yeah, I have a number of points or questions, maybe both. First, I would note that the Volunteer Fire Commission is not the Volunteer Fire Commission anymore. It's actually staffed by or populated by career and volunteers, and the volunteers don't get to pick their representatives. That's number one. So it's a volunteer commission in name only. What I'd like to know is who is currently the appointees of the Fire Commission and when do their terms of service expire? If we could get that list at your convenience.
Okay, you want the list? You want me to say it now, or you want me to send it to you?
I think just sending this, sending the list to all of us, to the chair, and get it distributed. I don't think we need to belabor individuals, but I'm just curious how many vacancies there are and whether there's opportunity to look at that.
Well, I will say we did put that out as an application last year for the people that out of the 9 are expired June of last year. So this actually going through the process right now to the names are being submitted to the county exec's office currently.
Okay, I would hope that this county executive takes into account what the volunteers would like to see rather than ignoring what the volunteers want to see, which has been what I've observed from the prior administration. And then speaking about volunteer facilities, one of the things about the last administration was it's probably the first time I've heard serious complaints from both the career staff and the volunteer staff about the operations of the fire department. I'm hoping that and I think from what I know, that's changed. And I'm not hearing it from either side, although I think it's a bit of I'm not sure it's a mistake, but I think it's an oversight that we have you folks sitting here at the table, and we're asking you questions about what the volunteers need, and we got volunteers sitting right here, and nobody's asked them what they think. Yeah, I think it'd be useful for us to hear what their perspective is on budgetary issues. I also want to just note, I don't want to go into any great detail because I know you're familiar with it, but the last administration wasted about $4 million building a temporary station in Beltsville, disrespecting the volunteers, the community, and the elected officials, and left you holding the bag. And now we got to figure out what to do with the temporary station. Was it $4 million spent on that, or how much?
I believe it was $2.4 million, but I will turn it over to Chief Gill.
And the chief's numbers are correct. I know when we came in right off the bat, we spent 1.4 million to final or finish the project, and it was dollars expended prior to what we paid.
I understand you inherited this. Not looking at you. Everyone's looking at you to help solve the situation that's out there. But it's probably going to, if the facility is taken down, that's going to cost a lot of money too. And I'm not sure it can be recycled to another use of any value. But that's something that I think where the volunteers, once again, particularly in that area, in my view, because I participated in those discussions, were not treated with respect. And the administration put up a temporary station without any permission or any approval from any elected officials. And now we got this situation where millions of dollars went down the drain. And then there's some questions about the contracts that went into that and who got the contracts and walked off with the $2.7 million. But I'll leave that there. But I think it'd be useful, if not today, but at some point, Madam Chair, that we hear from the volunteers about what they think in terms
Well,
of.
I'm going to call them up after, so.
I think that's great.
Yeah.
Then I'll be quiet and we can listen to them.
I think that'll be good. And it's good to see Kentland Fire 33 here. It's great to see you guys again. You want to respond to anything that Mr. Noak said? Okay, you're good. Okay, y'all are good. Well, with that, I'm going to give the volunteer representatives a chance to talk to us for a little bit. I'm going to keep it under 10 minutes, 10, 15 minutes, because we got a lot to do today. But thank you all for coming up. I appreciate it. And if anyone from our volunteer complement would like to come address the committee, we'd love to hear from you. The floor is yours. And I think if I'm doing that as well, I'm going to allow the our FOP as well to address us if they want. Why I said FOP? Our union. I don't know why I said FOP. Thank you. Aaron, would you like to come up too? Thank you. Yeah, I gotta be.
I thought he'd bring some back up.
Thank you so much. If you, I'm going to go with the volunteer first, if that's okay. And if you could just introduce yourself to the committee, and we'd love to hear your thoughts on our FY27 budget.
Wrong button. Sorry about that. Yes, hi, my name is Donald Wells. I'm the president for the association representing the volunteers. Thank you, ma'am. Nice to meet you, Council Chair. I'm sorry, Council Chair and Committee Chair. Sorry, I apologize. I did not come prepared. I did not think I was going to speak. I was just coming as support for the chief. I've seen the budget. I mean, as far as what you produced today, I'm glad you asked for the input from the volunteers because, as you said in the past administrations, that was not the case. It seemed like we were overlooked. I hate to say it in that regard. In some cases, we were. But I do agree with what the chief has done. And I'll sit here and tell the council, like I tell everybody else, this chief has been one of the most receptive ones that I've seen in years. She's willing to work with us. She's willing to meet with us. She's come out to many meetings, many events. She's always accessible by phone anytime I call and ask a question. I'd like to say that for all the volunteer corporations, that she's there. She answers questions. She will respond back. other than that, like I said, unfortunately, I didn't come prepared for this at all. I
Oh, that's okay. We can have a follow-up conversation as well. I appreciate hearing that. I just wanted to make sure we were here in the committee, and I didn't realize it was just my purview of who comes. So I just thought, why not? We're here. So, and ma'am, if you don't mind just introducing yourself, and if you have comments, great. If you don't, that's okay too.
Hi, I'm Chief Janet Demerit. No, quite a few of you. I'm the Chief of Volunteer Marine Fire Rescue. I as well did not come planned today, but first off, I'd like to say it's very refreshing that we have a fire chief that has been very proactive in trying to fix a lot of mess that we have. The volunteers have not been treated well. You talk of how long it takes to get volunteer career through a process. You don't know anything until you deal with volunteers, because it's a very long process. We deal with the physical, where we only have certain physicals can be done during the day. Our Air Force military members, they can't just take off from Andrews. There's no evening physicals. So there's a myriad of issues that could be addressed and should be, because you have people that are working for free. So let's make them feel like we really want you here to work. Tom's heard it over the years. Over the last administration, and I say this a lot, how many times you tell somebody they can't come to your party before they go, you really don't want us here? So there's been, which we're not going to get into today, but a significant thing that came across with our budgeting. If you don't have the minimum amount, probably we're under poverty at some of the stations, then people are going to go to other places. You talk about career people going to where they're paid more. Are you going to volunteer at a place where I can't even buy you pizza? Are you going to go someplace where they can give you everything? I mean, money's for night outs, the best apparatus, uniforms. So I think we have a surge, what I'm seeing, of people that really want to volunteer. They want to give back to their communities. And we have a chief now in administration, the group where we're just like, this is what we needed like years ago. So now that we have that, we need to build on that for these stations that really have volunteers, but they have to feel like, and you all are included, that you want us there. Because not only do we serve, but our families serve. We leave our families. And then we've got the price of gas now. I've got college kids, you know, the cost just to drive to the fire station. We have to say, we really want you, and I think you need to support the fire chief and her staff and how we can get these volunteers in. And just like the career did their budget, ask us about ours, because we don't, I mean, most of us, everybody wants everything. We don't want everything, but we do want, so we can beef our staffing back up, because we need the training. We need it in hours that the volunteers can do it. It can't be while they're working. So I know some of our stations are suffering. A lot of that, you know, we have war, people go away. It's always that, the waves, right? Getting people in. But we would really, really appreciate the help on getting more in, and the ones we have feel that you really want us there, to be honest. And no disrespect to anyone here, but you know, that you really want us there.
Understood. Well, thank you for that. And Mr. President Walker, always looking sharp. And you're fire excited to have you here. I want to make sure our amazing firefighters in our union also have a chance to address us as well. So if you don't mind addressing us on some of your thoughts on FY27.
Yes, ma'am. Thank you, Madam Committee Chair, for the invite, and esteemed members of our council. For those that don't know me, my name is Grant Walker. I'm the president of the Prince George's County Professional Firefighters and Paramedics Association, representing the active and sworn members of the career service here in Prince George's County. Specific to the budget, quite frankly, we are still hurting from mandatory overtime and personnel. The reality is that the budget does not go far enough to hire enough personnel to adequately staff this Prince George's County Fire Department. Quite frankly, I don't think that there's enough people that you could put in this budget to get us there, unless the county is willing to hire roughly 800 firefighters in a year. The reality is that while I appreciate the volunteer firefighters that are up here, the county has asked our volunteer members to pay their taxes and then to go get a fire truck or an ambulance out if they want it to come out of their firehouse. That's not a fair expectation of our volunteer workforce. They have lives, they have personal commitments, they have kids. Prince George's County cannot expect its taxpayers to continue to pay its taxes and then not provide a fire and EMS department that is commensurate to being the 13th busiest jurisdiction in the nation. I appreciate that the fire chief and her staff are working to expedite the hiring process. Any delay in a budgetary process means a 2-year delay in hiring. If it takes 9 months to get a firefighter in the door and another 9 months to get a firefighter trained, you're looking at 18 months. Well, the budgetary season only comes once a year. The reality is that our firehouses, some of them were built 100 years ago. They have met or exceeded their intended lifespan. We have CIP that's been kicked down years and years. I attended a groundbreaking ceremony for a firehouse in Oxon Hill in 2017. That firehouse is still not built. The permits were put in 2 weeks before the MGM Grand. And the MGM is built and our firehouse is not. We have another firehouse on Shady Glen at Hill and Central Avenue that a fire was set in a home to do a training burn for CRS 29. They were retirement eligible before we broke ground on that firehouse. Fire trucks take 4 to 5 years to build now due to industry standards. Any delay in capital improvement, investment into our infrastructure for fire apparatus, or delays in hiring of personnel will not get us out of this hole. I respect the work that some of our volunteer corporations are doing. I'm a little concerned that according to the budget documents, there's over 1,000 volunteer firefighters, but they're concerned that there's not enough. I hope that they return to responding. Roughly 10 of our firehouses are out of service every single day in Prince George's County. We don't have enough staff to staff those units. Mr. Adams, you talked about Station 35 and 39. It takes roughly 30 firefighters to staff one firehouse. If we're only increasing our complement by 47 people, well, that's only one firehouse worth of people. If we've got 10 out of service every single day, depending on if volunteers got off of work, are going to skip their kids' soccer practice, are going to not go to work, there's clearly not enough people in the budget. I appreciate the work that the administration has done to close our budget gap and a commitment to increasing our allocated strength. We have a pay disparity in our workplace. Chief alluded to that we are losing people to neighboring jurisdictions because of pay. And I'm hopeful that through contract negotiations, we will get that pay disparity fixed. But you have a tough job here. Everybody is asking for more personnel. The difference in our industry versus other industries is that it's life and death. Seconds count. And if the firehouse that's closest to you doesn't have a fire truck, doesn't have a person on that fire truck, then it has to come from farther away. And when we're already running more calls than we've ever run in the history of this fire department as the 13th busiest fire department in the nation, there needs to be a real commitment to a renewal in public safety specific to the fire department to address our facilities, our apparatus, and our personnel. Thank you.
Thank you so much, President Walker, for all you do every day and the advocacy that you bring. So I'm sorry to put you both on the spot like that. I didn't realize, Madam Chair, that I can just have who I want all the time. So I will take that going forward. I didn't know that I could do that. So I thank you. And I will say, as we conclude both fire budgets, that I do think there's a commitment, Madam Chair, from this council on the personnel number, and I'm going to be looking at all of the concerns that you all have raised, and we are so grateful for the lives that all of you save. Our administration, our volunteer, our firefighter, our professional firefighters, our EMS, we could not be more grateful for the work that you're doing to respond every day. So I just want to say thank you. And now this concludes. Oh, wait, did anyone have a question? They're good. This concludes our FY27 budget hearing for our firefighter, fire department, and volunteer commission. Thank you all so much. And at this time, I'll turn to our last agency of the day. Thank you for being so patient. I had fire waiting on a different hearing a different day, so I try to be fair. Is our Department of Social Services. If you could come forward, I would appreciate that. And I will turn to Mr. Tutt to introduce your budget. Thank you so much. Thank you for your patience and thank you for joining us today. Thank you.
Joining us at the table is the Director of the Department of Social Services, Ms. Jennifer Amaya Thompson. And in your virtual binders on page 35, you'll find a budget report. And when you're ready, Mr. David Noto will provide an overview of the budget.
Good afternoon, Madam Chair and members of the PSHHS Committee. My name is David Noto, and the following is a presentation on the FY27 proposed budget for the Department of Social Services. The Department of Social Services is a quasi-state agency and receives a majority of its funding and personnel from the state. These funds are not reported in the county's budget because they're not grants but direct funding. This presentation focuses on the county's portion of the department's budget unless specified otherwise. Okay. The proposed budget for the Department of Social Services in FY27 is $27.9 million, a decrease of $2 million or 6.8% below the FY26 approved budget. This is primarily due to a reduction in grants in the community program division. This slide goes over the general fund budget for the department. The proposed grant fund for FY27 is $18.36 million. This includes the county obligation cash match of $549,000. As was previously stated, the grant fund for the department in FY27 decreases by $2.46 million or 11.8% below the FY26 approved level. This decrease is primarily associated with reduced funding for the Office of Home Energy Programs, or MEEP, the Office of Strategic Partnership and Community Solutions, the Permanent Housing Program for People with Disabilities, or HELP, the Transitional Housing Program, and other programs in the Community Services Division. Most of these are state and federal grants which support those in danger of becoming unhoused or assist low-income families with housing costs like winter energy bills. The Office of Strategic Partnership and Community Solutions connects parents to resources at community schools. This program is also proposed to receive additional funding from the general fund budget this year, as is required by the Blueprint for Maryland's Future. This slide shows the proposed staffing level for the department. The total on the slide represents the county-funded positions only. With state-funded positions, the total number of authorized positions comes to 685. Only about 4% of the department staff are paid for with county general funds. This slide shows current vacancies in the department. In conclusion, a significant challenge the department faces is that the department is required to maintain a homeless continuum of care structure to access federal, state, and state funding to support unhoused residents. However, federal changes to HUD's Notice of Funding Opportunity will significantly impact the county's continuum of care. Among these changes are a shifting of structural requirements from a housing first model to a treatment first framework. Other changes include reducing the protection of existing permanent housing projects, capping them at 30% of the annual renewal demand. This necessitates a fundamental restructuring to prioritize transitional housing over permanent supportive housing, while strictly adhering to new federal mandates regarding participation in supportive services and the prohibition of harm reduction practices. Consequently, the county's continuum of care must adapt its governance charter and ranking policies to remain competitive in a national landscape where 70% of funding is now fully discretionary and tied to federal policy alignment. At the moment, there has been a temporary return to the FY24 standards that includes the Housing First model. This is due to legal challenges. So it remains to be seen how these changes will play out and when. This concludes my presentations to the committee. Thank you.
Thank you so much, Mr. Noto. Now I turn to Director Thompson. Madam Director, it's so good to have you here, I think for the first time in front of this committee. So it's great to have you. Congratulations on this new role, Madam Director. And if you want to go through your presentation for your FY 2027 budget.
Very good. Okay. Hi, good afternoon, everybody. I'm Jennifer Amaya Thompson, the director for the Department of Social Services, currently in my role for about 110 days. So I am honored to be with you and to serve as the director of the department. Just really quickly, I am coming from the U.S. Department of Health and Human Services under the Administration of Children and Families and the Office of the Secretary at the federal level. I am here with the Department of Social Services to really continue life commitment to serve the most vulnerable families and children and communities, to improve lives and to provide an opportunity for future and better generations. So that is a little bit about myself. Next slide. Thank you. So within the mission of the department, just a reminder that we provide services and opportunities and supports to our residents to be independent, responsible, and stable members of the community. Some of the focus areas for our work is on intervention services, stabilize families and individuals to assist adults and families in need to achieve and maintain permanency in the community. Some of our priority population is children, youth, and adults that are at risk of abuse, neglect, and mental health and injury. And we serve residents experiencing episodes of unsheltered or house experiences. So this, we just wanted to provide you with an organizational structure. As you probably know, the department has gone through a series of leadership changes in the past year or so. So we just wanted to provide you an overview of the different divisions that we provide services to. And again, it's a combination of state and as well as county efforts to support our residents. Next slide, please. So for the strategic vision of the department within the past 3 or 4 months that I have been within our department and our executive leadership, some of the changes that we have highlighted is to really concentrate the efforts of the department in terms of our culture, internally and externally, to provide an environment of support and inclusivity and engagement and communication really for the stakeholders that we are providing services to. What are some of the supports that we provide that the community might not be familiar with, but that is a priority within the department, and to provide consistent messaging about the contributions and outcomes that are provided to the residents. And then again, for us is to continue to represent our residents with dignity, respect, and kindness. And the most important part of it too is to make sure that our agency continues to be an agency that uses data to inform the decisions that we are providing services and delivery impact. Next slide, please. And then here is just to basically give you at a glance on who do we serve within the Prince George's County. We serve about 350,000 community residents, which is about 1/3 of the population in Prince George's County. We provide translation services to over 140 different languages, and we have a staff of 500 staff services within the county, state, and county staff as well. And just locations where we are, we have 5 different locations: Center Point, Northern County office, Central office, the Southern County, and again, Center Point. Next slide, please. And then, so to what we do, and I apologize, I totally forgot to introduce my staff and my leadership who is here with me, if that's okay with you. Is that all right? So would you like to introduce
That's fine, Madam Director. You can do that now or when
I
you're done.
appreciate that. Thank you.
Hi, good afternoon. I'm Jamie Dixon. I'm the Deputy Director of Clinical Programs and Support Services.
Hi, good afternoon. I'm Yusuf Sanut, Chief of Budget and Finance.
Hello, I'm Tahila Benton. I'm the County HR Manager.
Good afternoon, Eob Goro Michael, Assistant Chief of Budget and Finance.
Good afternoon, Delaney Aware, Assistant Director, Family Investment.
So as you can see, I brought my team with me, right? So go ahead, Jamie.
So in terms of what we do, particularly under Child, Adult, and Family Services, our focus is stability and support. And so that includes child protective services, adult protective services, specifically around exploitation and abuse, as well as out-of-home care, which is formerly known as foster care and adoption. Those are some of our highlights for the Child, Adult, and Family Services Division. We also have a Family Investment Division that provides more of the eligibility supports. And so that is more of the SNAP, which is formerly known as food stamps, our medical support appointments, and burial assistance and things of that nature. Previously, we had a division that was the Community Services Division, which is recently transitioned as of January, and we're in the process of finalizing those that transition.
So what we wanted to just highlight for you is some of the efforts that we are conducting right now within the department to really highlight public safety. So we are working with the Department of Public Safety, Correctional Services, the Department of Human Services, and the Department of Juvenile Services to provide opportunities for our youth who have been impacted by the judicial or the justice system. And we are part of the governor's initiative on Safe, Stronger Together, and we are really looking forward to what that means within our residents and our youth to make sure that our communities are safe, but also to make sure that we're providing the supports that the youth need in terms of training and skills and going back to school. And UNICEF is the Children's Cabinet, but that's, thank you for moving it forward. And then here is just to provide you with highlights of the work that we are doing right now in relationship to the county has been highly impacted by the deportation and by ICE impacts into the community and our residents. So we are invested in really working across faith-based organizations and community services to represent the work of the department in a way that our communities feel trust and feel that they can depend on the services that we are providing and how we are in consideration to the work that they are doing. We are also working with the county executive office for immigrant residents, as well as the governor's office of immigrant issues as well. And then family investment highlights. Delania, would you like to make some?
Sure. So the Family Investment Division, as stated earlier, administers the mainstream benefit programs like SNAP. The federal government holds us to a 95% payment timeliness rate. We have continuously exceeded that rate at the 97.56 percentile for all the applicants received within our agency. Another highlight we wanted to share today is during FY25, our offices served over 190,000 residents came through our doors for services. Over the past 3 months, we've served just under 40,000 residents, and we consistently serve over 10,000 residents each month. Additionally, in 2025, we opened up a volunteer tax site where we were able to assist county residents file their income taxes for free with volunteers. And we saw approximately $110,000 in federal refunds last year and another $63,000 in state refunds. This year, we helped over 100 Prince George's County residents file their income taxes, where we saw $129,000 in federal refunds and another $66,000 in state refunds. So just a few highlights for the Family Investment Division.
Thank you, Delania.
With regard to the,
Yes.
okay. With regard to Child, Adult, and Family Services, some of the highlights was launching an after-hours unit. Previously, in terms of screening and if there were crisis situations where there needed to be an assessment of a child's safety or even an adult safety, we would have to tax our regular daytime staff to provide the coverage. We now have a specific unit to cover those core hours to make sure that those calls are consistently responded to, but without burning out our regular daytime staff. We've also continued with our kinship initiative, which was a major initiative that helps to support that when there are removals, that we look to kin first. The new legislation that supports that has helped to adjust some of the licensing requirements for kin so that they can get reimbursed and support that they were not able to get necessarily prior to the legislation. Another highlight that we wanted to add is our efforts to create a pipeline from career to human services. This year, we had about 20 student interns that ranged not only from master's levels, but even high school students. And so that's something that we're really proud of.
So Tequila, can you go over this for us, please? So this is just to provide an overview about the vacancies of where we are in terms of the county and the state.
Okay, so in FY '24, the state was 15% at their vacancy rate, and then
Do you mind putting that? Okay, here you go.
at 31%. The county for 2025 was at 39%, and then recently, as of March, was at 18%. The field positions for the county contractual is 133 positions filled, 21 positions are vacant, and we have 48 that are unfunded. Merit positions, we have 39 filled, 17 that are vacant, for a total of 172 positions filled. And the total overall is 258 for the vacancies.
And may I just make a highlight? So if you can see from last year, we have a rate of 39 vacancies, and now we're down to an 18%. So we are really excited because we've been working on filling up empty positions. So this is an effort collectively across the department.
So, and then we have upcoming positions as well, but I think you all are going to another slide, so I'll.
Go ahead if you want to share something.
No, just that we have accounting positions that will be filled soon, 2 accounting positions, and then an administrative assistant, and then an account clerk, as well as the special assistant to the director, who we are looking forward to coming on at the end of May, as well as a special projects coordinator for her. And then we are working still with the community service division on getting them energy certifiers and reviewers as well, and some administrative assistant clerks for family investment. So we are, like the director said, diligently working to be able to improve our vacancy rate.
Thank you, Tequila.
You're welcome.
There you go, Yusuf, this is your turn.
This slide, what it depicts is that we got direct benefits, which is on the left-hand side, which is for SNAP, TCA, etc. Our budget is like 87.8 million. Of that, 9.7 million is county budget. And we got exams of 20 million plus, which is comprised of both federal and state. And we got a state general fund budget of 57.5 million.
Thank you, Yusuf. And what we wanted to do here is just to highlight for you the partners and the vendors that work across the county to provide services to our children, families, and communities. And again, we are exploring now within the next 3 months the opportunities to enhance our partnerships with faith-based organizations, community-based groups, and nonprofit organizations as well. And that's it. Thank you. Now we are open to your questions.
Yes, and before I go to questions, I just want to make sure that I did not earlier, I saw her, but I didn't say anything. And I want to rectify that. I want to recognize our intern Deputy Chief of Staff for Public Engagement, Ms. Shaka Khan Reed, who has joined us, and she is going to be overseeing a few of the responsibilities under Health, Human Services, and Education. So I thank you, Madam Deputy Chief of Staff, for being here and joining us for these budget hearings. Yes, I'm sorry, ma'am. Do you mind coming to the mic? I'm sorry, Madam Intern Deputy Chief. Maybe I said that wrong. I'm so sorry. If you can correct me, DCAO, if you can correct me.
Sorry, it's not your fault that we realized that the message went out incorrectly. I was previously the Deputy Chief of Staff for Public Engagement. I am currently the interim Deputy Chief Administrative Officer for Health, Human Services, and Education. It was an error when the message went out yesterday, and so they're rectifying it now. So I apologize for interrupting. I thank you for the acknowledgement, and I'm here to help when I can.
Yes, thank you. Thank you, Madam Deputy Chief Administrator. I thought I was reading that weirdly, but I was just reading it. I apologize. Congratulations on this interim position as our DCAO of Health and Human Services and Education. Look forward to you looking at the agencies in your purview through the budget cycle.
And thank you again. Like I said, I appreciate the acknowledgement, but they're rectifying it. So a new email will go out soon.
Thank you so much.
Thank you.
Appreciate that. Ms. Reed. And then thank you so much, Ms. Thompson, for this. I have one or two questions, but I know some of the colleagues have questions. I'm going to start with Councilmember Hunter, and then I'll go to Councilmember Burrows.
Good afternoon, and
Good afternoon.
thank you so much for being here and being patient. I'm just curious about the services that are at the greatest risk if the vacancies are not filled.
Family investment.
So I'm grateful to say that we are coming to a place where our vacancies are being filled, but some of the risks we experience or challenges we experience was overloading our staff, overwhelming them, burnout, call outs. And anytime you suffer a shortness of staff, then you also have some concerns around your quality and your output. And so we've been working really hard to mitigate those concerns as well as onboard new staffing. So grateful to say that we are where we need to be now.
Okay.
With our staffing. Thank you for
Thank
the
you.
question.
I'll go to Mr. Burrows and then Mr. Denoga. Mr. Burrows.
Thank you. I appreciate this presentation because I got a good sense, especially from your remarks, of the amount of people that you're helping, which is, amazing to hear. I feel very disconnected from this department. I have people who reach out to my office every day, and I never think to call Department of Social Services because Department of Social Services, to my knowledge, has never provided support in that way. And so, like, for example, I just had my office bring down this latest email that I just got today from the 29th. It's a resident of Fort Washington, single mom of 4 who lost her job, who's looking for assistance, utility assistance, and she's afraid that she's going to be put out of her apartment. I've never once been able to say, social services, can you help me? And maybe that's because I don't know the process that you all use, or I know in the past the funding has been maybe limited. So by the time, depending on where we are in the year, maybe the funds are gone. I'm just not sure. So can you articulate what process should we use as council members when we have people who are in dire need?
Absolutely. So I appreciate that. And one of our priority is changing the narrative, right? So changing the story of who we serve and how we are accessible to our community members. So if there is a question regarding specifically that comes from you, those questions usually go to the director, and the director distribute it to the different divisions, and the divisions report back to the director that your requests have been addressed. But we also have a customer relationships office. And Delaney, do you want to talk a little bit about how do we support the customer services?
Sure. So we have our Directors Constituent Services who usually speaks with anyone on the council team members, your customer relations team members, also anyone from the Office of the County Executive. Their concerns are sent through our our Directors Constituent Service line, but the directors and assistant directors are also welcome any communication you have regarding your constituents to ensure that they get the necessary services and navigation to the correct services for wraparound for their households.
So go ahead. No, I was going to say for council members to know, who do you want us to directly email when we have a constituent so that we get sort of the follow-up from social services? Like, what human am I emailing in the county system?
You can email me.
Email you, Madam Director? Just send it to you.
Absolutely, yes.
Okay.
I've also fielded calls specifically with your office, Councilmember. Colin, I think was the gentleman's name.
Yeah, about 2 years ago. And so This is news to me because, I get inundated from seniors, and I have a lot of senior programming, but if you're not a senior, the safety net is not as strong. And so I think now that I'm aware, I'm going to make sure I send it to you both. And the only thing that I request is that let us know what happened.
Absolutely.
Yeah.
Absolutely.
Yes, so generally, depending on the nature of it and confidentiality, we will definitely confirm receipt. We will definitely confirm that we reached out. But based on the level of detail of how we've been able to support, we're sometimes limited in being able to answer. And so, but we'll definitely confirm that contact was made.
And that whatever the issue is, so like, for example, in this case, where you have a single mother of four who's about to be put out of apartment and utility bills, if I send this to you, the thing that would be important for me to know is that she's not been put out or that the bills have been paid. Because if not, then I'm going to call my local nonprofits and churches and I'm going to try to fill the gap. But I just need to know if you all have taken care of it or if it's something that we need to do.
So, it's a process. So we would need to assess the specific needs, the level of, the amount, whether, so there's an assessment process. And so I'm not sure. I think we'd have to talk about and even engage the family. Is it okay if we're disclosing, further their information, whether it was resolved or not? And so we could work through that.
So if I may just add a little bit more about what Jamie is expressing is that customer service is a priority to us. And then within my leadership, we are working across the different divisions to make sure that we have a system in place. And then although it is a process, but we're trying to address and redirect a lot of requests that are coming, similar to your request within the community services division, that they manage the utilities, that they manage the food pantries, that they manage their own house for shelters. So we are redirecting and we are making sure that we are following up. But we appreciate you bringing that to our attention because I think it's also knowing who you need to contact to, right? And the follow-up of the requests that are coming in that needs to be reported back. So we appreciate the input that you are providing for us and we'll work on that.
Thank you.
Mr. Denoga?
Thank you. What was the number for the point in time count back in January in terms of county homeless?
We don't have that data. That is through the community services division, and they will have that data for you, and we can follow up on that directly to send that to you.
What is the community services division?
Yes, so the community services division is the division that oversees the own house, that oversees the shelters, that oversees the nutrition services in regards to the for the food pantry. And then so right now they're currently on a transition so that they will be transitioning out within the Department of Social Services going to the county executive.
Okay, I saw it on the slide. Okay.
Yes, yes. So we will get that data for you if you need that data.
Okay, 'cause I was going to ask, ever since I've been around again, we've been trying to build a homeless shelter and not succeeding. And it says in the budget, it's going to start in the construction will start in or design FY 27. CIP budget's usually full of things that are fairy tales. Is that a fairy tale or is something going to get built?
We will follow up on that to your request.
Okay, not your department anymore. I got it. All my questions were in that regard, so.
Okay. Thank you, Mr. Janoka. And I just wanted to follow up on just a few things. I know especially when it comes to some of our federal grant opportunities and just the way the country is changing when it comes to applying for support. You don't have to answer everything right now, but I think it would be helpful for the council to see what you're doing in the strategic plan ahead. with our new federal, and then it ends up in the state reality. I know there's probably a lot to discuss, but I think having a sense of where how you're thinking about it, Ms. Thompson. I don't know if there are private sector dollars that we can go after or things of that nature. Would be helpful to know. You know, sometimes I think the county can be very used to doing things the way we've always done it. And, you know, I see these big NGOs getting money from like the Kellogg people and those, you know, those really big money, folks that give. And I think it's almost coming to a point, well, now they might want to give to government and not just, you know, 501c3s because we can't provide the same way. So I was just curious a little bit about, you don't have to go all into it, but if you could respond a little bit about what you're thinking to a new strategy when it comes to, you know, the grants that we're used to getting that we're not going to probably be getting anymore.
Absolutely. So, JB, do you mind sharing a little bit about the type of grants that we are applying right now for services under the Child, Adult, and Family Services Division?
Absolutely. So we've always received support for our child adolescent clinic, which serves as a way to partner around law support with the state's attorney's office and even mental health services to ensure that victims of abuse and sexual assault are not re-traumatized by having to tell their stories. So we pursued successfully grants from the Governor's Office of Crime Prevention to ensure that there's sufficient funding to maintain that child advocacy center. So that's one way. A lot of our grants in the past have really been through the Community Services Division and the homeless. I think Delania, are there any federal? I know that SNAP has really been affected even during the government shutdown. I don't know whether there are other grants or anything that should be mentioned at this point.
No, the state is addressing the shortage from federal government funding.
Yes, they are in their last budget, but that's also because then on the other side they have us paying for more things on the other end, by the way. So it is addressed, but like on the county taxpayer, not fully, but yes, because we're mandated to pay other things. You see what I'm saying? Go ahead, Director Thompson.
One of the areas that we are exploring right now is relationship with foundations.
Okay.
So last week I had the opportunity to participate in the Casey Family Services Foundation meeting across the country, and it was a conversation about 3 specific areas. The first one was about support with faith-based organizations, a nonprofit, and also private foundations to support the families and youth that have been impacted by deportation. So we have efforts that we are currently exploring in terms of foundation supports to us. We're also experiencing more enhancing the relationships with the institutions of higher ed so that we can also bring knowledge and skills within our own workforce, but also exploring the opportunity to develop memorandums of understanding into the type of services that they can provide to us and the supports that we can provide to them as well. So an exchange of services.
Awesome. And then something specific in my district that I wanted to ask you all about, and about your assistance with, actually sooner rather than later. It's been a long-going issue. I have a very large unhoused population on University Boulevard. I'm sure you're very well aware. I'm working with the great Tom Dernoga on one of my bills on trying to find folks that have basically open space that don't do anything to secure their space. So basically we just have under the power lines behind the McDonald's and the gas station, University Boulevard, we just have acres of open land that's housing unhoused people all the time, causing crime, causing issues. And I would say the further point, and that's the point where social services comes in, is a very large majority are addicted to drugs. You can see people just standing. I was like, we don't even have to go after hours. Like, we can all drive over there 3 o'clock. Like, and I live there. So I live in that community directly. And people are just like standing in the middle of the street. Like, you can tell that they are, in a zombie-like state. So I think the community, I think there's one thing, there's one thing with our unhoused population, our homeless population, some, have different reasons they want to live there, spend time there, but they're doing maybe different things during the day. Maybe they're doing productive things during the day. That's one thing. But there's a very acute population, and literally, I don't even have to know their names. I could describe like 5 residents over there, 5 community members that need drug help. And I think everyone in my community could describe 5 of them. So I wanted to know, how does a council member, I'm using my specific district, I know Madam Chair has different situations in her district, and all of us do. How does a council member engage with you all to go out there and provide services? And particularly, I would love to see people move to better situations, but also in particularly on drug treatment.
Absolutely. One of the efforts, although those specific services are provided through the Community Services Division, what we're trying to do within the Department of Social Services to maintain the relationship and enhance the work that we have been doing in the past with our own Division of Community Services. And I think that this message, we will definitely bring it back to the Division of Community Services and brainstorm.
Madam Chair, say the Division of Community Services, who's it
So
under?
we have a new associate director. Her name is Letitia Craig, but it is under the ADCAO and the DCAO for the county executive office now.
Okay.
Because it's transitioned to the county.
Okay.
So
Well, I would love if we could go out there in the next 30 days. If I can I want to go out there, and I also wanted to see if you partner with University of Maryland. Do you remember I don't know if they still do it because it's like COVID's kind of changed everything. But remember University of Maryland used to have that bus they would bring out with services and to help with homeless. Do they still have that? Do you know?
Yeah, I used to work there. So
Okay.
yes, I went a couple months ago. They still do have that bus there.
Can we pick a date, Madam Director? Can I put this on you, Madam Director?
Yes.
And of course, I have the lovely DCAO, Shaka Reed, in the room, so she's listening. I would love to go out there in the next 30 days. And I really want to demand University of Maryland to partner and come. And the reason why I say this, right, because I look at things long term. Purple Line is right on University Boulevard. So in 2027, you're going to have University of Maryland students riding the Purple Line, seeing everything I'm talking about. Okay, just people standing, drug addicted, blah, blah, blah. Some students that come from very different walks of life.
Yes.
Very different races, different backgrounds, and they're not used to any of that. Students from University of Maryland are going to constantly be in and out of the Langley Park stop. And the university needs to do more and lean in more to make this corridor safe, because their students are going to be in the corridor in a more exacerbated way than they are now. They're all in my, I'm sorry, I'm the chair, so here we go. They're all in my district they're at the mall at Prince George's, right? The mall at Prince George's, thank God, is incorporated in the city of Hyattsville. So that's Hyattsville police responding. And we've got a lot going on there and a lot of eyes and things going on there. But University Boulevard and Langley Park is unincorporated. The only thing they have is me. Okay, they only have the council member and the state senators, which don't directly do the everyday work we all do. And I'm telling you, it's a ticking time bomb. I'm saying it on record, on video, everyone heard me. They can come back to this date. So I would like us to see, and since maybe you already worked there, I forgot your name. Miss Tequila, if we could get them to commit to come out, because if we do not clean this up before Purple Line opens, I'm telling y'all right now, I'm not gonna be on the council anymore, but I'm telling y'all right now, it's gonna be really bad. You get the wrong incident with the wrong child from that university on our watch in our county, it's going to be on our property. It's going to be bad. So I just really want us to, if we could just laser focus on that. And I would love to go out there and provide services and help in the next 30 days. I am working on the other part. It's not just University Boulevard. I have something over by Green Meadows. My other colleagues have. When we have private landowners with these open green spaces that are not parks, right? They've got open green spaces and there's no fencing. The private owner is not securing it. That's where people go to congregate to do whatever. And then it's hard for us because it's not county property. So you need the private owner to deal with the trespass, to deal with, and I have a bill coming up to try to fine them at a higher rate, to to use the stick to make them enclose these properties. So it wouldn't affect residential, just because I'm looking at Madam Chair, it wouldn't affect residential, but it's commercial and utility landowners, because that's where people are congregating, right? It's not private, it's not public property, it's not our property as a county. And so I just want the department to put a little bit more effort. And then my other things, I would love if we could get a date, and I'll follow up with you, but if Director Thompson, you follow up a date for me. And then the other issue that I'd like you to talk about a little bit, you had a lot of your partners on the page, and I'll tag Tom because it's in his district, but I get it's very different when you have high school children call you and complain about something. It's a very different thing because it's not what they tend to do. But I want to know your partnership with the school system, and I hear a lot about drug use at High Point High School, a lot in the community. And I just wanted to know, like, how does social services interact with our schools with that? And the reason why I bring it up is that I've been in the community and I've had young people, 13, 14, 15 complain. And so I think that is something that I wanted to know. That's just one specific, I just wanted to highlight one specific thing. I'll let Mr. Janoga speak on that more if he wanted to. The school's in his district, but my children also attend that school, so that's why we almost share a little bit. But I wanted to know, like, how does that partnership work? I always find it's very hard to enter the schools. So, like, how do you all work with the schools with things like that?
Currently, Jamie, do you mind just speaking a little bit about our current partnership with the school system?
Right now, it does fall under the Community Services Division, but we do have community advocates in about 20 middle schools that help provide support and linkages to our normal social services and help fill the void to ensure that students are able and ready and prepared to be in school. So it's not specifically around drug support or addiction, but they do some self-esteem and support groups, but it isn't treatment. And it isn't, it is assessments, and it would be a linkage or referral for services.
Okay, thank you. Well, that concludes my question/request. And of course, I have to recognize our former council member, Calvin Hawkins, DCAO of Economic Development, something like that. I don't know all your titles, but we appreciate you. Colleagues, do you have any other questions for Department of Social Services before I say, Madam Chair?
Thank you. Sorry that I had to step out. I had my little toddler with me and Daddy was picking him up. So I apologize if you guys went over some of these things already. I saw that one of the parties were around completing protective service responses within the mandatory period. So I was just curious, are we not meeting that standard now? And it's our goal to start meeting that standard, since I saw it highlighted as a strategic focus.
No, we're meeting it, and we just want to maintain that as always.
Oh, okay. So it's not a concern. Like, perfect. Okay, thank you. And then I saw under the FY26 approved budget, and then eliminate the prior year appropriation for the youth homeless system improvement. And it's in parentheses enough, so I wasn't sure if this was like the enough grant that came down from the state that transitioned out, and just what impacts that would have.
So for the Enough grant, we were a quarterback and working to, we were just on, I think it's the first phase where it was bringing the communities together. And so I don't anticipate any downfall. I will say, though, that does fall under the Community Services Division. And so we would need to speak with them to provide more details.
I'd have to see. And so do they pick someone else to quarterback, or are they saying, I guess, what happened to the shift of why it's not sitting here anymore, or where would it sit within the county now?
Go ahead.
They're going to be with the county executive office.
Oh, so the money isn't leaving, it's just moving to where it sits. It doesn't sit within your division anymore, but now it sits in a community service under the county executive, like in her executive office.
So we are currently right now in the process of transition and complete and finalize the transition. But what we do know is that the county executive office is in conversations with the Department of Human Services to finalize the transition. And what we're hoping is that by the beginning of FY27, we will have that established and finalized. So that is where we currently are.
And so it wouldn't sit as a standalone agency, it'd be an executive level position within her like cabinet, just so I understand like structurally, or what's transitioning out to sit with her.
There have been all of the services and supports that were previously under our community services divisions have been shifted. And so that is our sheltering for unhoused. There is a outreach team that goes out as
the street team.
Yes, all of those services. It's the food pantries and the school programming.
So all of those programs are no longer going to be in this division.
Correct.
Correct.
But now they're going to be in a new division called Community Services.
So the division currently is the Community Services Division under the Department of Social Services, but it's going to be moved with the County Executive Office. And we have our DCAO that is with us today, and we're looking forward to that transition where we will continue to work from the lens of the Department of Social Services and the County Executive Office.
Yes.
Hey there, Andrew Pierce, OMB. So just to clarify, in the budget, everything y'all are talking about, that's sort of in the process of being discussed. I think you had a specific question about the Enough Act grant going down, and that factually went down. It went down.
So it didn't move, it actually went down.
It went down.
Oh, okay.
And that's part of the state budget balancing stuff that they've got going on. There is some shift between the different agencies, the health and human service agencies that are receiving funding from the governor's office of crime policy prevention. I don't think I had the acronym right, but anyway, overall funding is still coming to the county, but it's the priority from the governor's office has factually it's shifted. This other part that y'all are talking about with the community services division is a shift that's still being worked out. We haven't totally worked out all the details for that yet.
So that wouldn't be reflected in this budget.
Correct.
So that if that change does happen, it will happen during budget negotiation.
Right.
Okay. Thank you.
Yes, ma'am.
And I can't remember if this came from you or if this was in your presentation. It was about the shift from, I guess, transitional housing priority to treatment housing on the federal level and what that would mean. Can you just like explain that for me a little bit more on the impacts from a housing perspective?
Yes, ma'am. So this was a transition within HUD specifically, and it's causing a shift nationwide, actually, from what's called a housing first model to a treatment first model. And so what that entails is requiring folks who would become eligible for housing to go through treatment for potential drug addictions before they would be receiving their housing. And
so it would make it a requirement to go to treatment first?
That's correct.
And so is that based on if that is an issue for them, or regardless of that?
Presumably, I believe that the assumption is that if a person was suffering from substance use disorder, then they would be required to participate in some type of drug treatment program before they would become eligible to
be in the housing program.
Exactly.
But that'd be only if the caseworker or the individual noted that as an issue, but it wouldn't be mandatory for anyone getting housing. I just want to make sure I understand that.
That's correct.
Okay. Thank you.
Thank you, Madam Chair. You always have very insightful questions. Well, this time, not seeing any questions, I thank you, Director Thompson, and your team for coming to present your FY 2027 budget. Thank you, Andrew, for always being here. And you are dismissed. And at
Thank
this
you.
time, we will adjourn. Can I get a motion to adjourn?
Motion adjourned.
Second.
Motion adjourned by Chair Oriata, second by Councilmember Hunter. We are adjourned. Thank you so much.
Thank you very much.